So today on our journey of Childhood Cancer Awareness Month, we're going to talk about another stop, and that has to do with treatment. It's one of those things that all of our families and all of our kids go through, and it varies. But instead of hearing from me, to hear from one of our great camp doctors, Dr. Stephanie.
Hi all, I'm Dr. Stephanie Thomas, Dr. Stef as people seem to call me, which I prefer, and I am a pediatric oncologist. I used to be at Children's Hospital Los Angeles, and I missed everyone there in LA so much, and I am now at Cleveland Clinic Children's, where I lead our adolescent and young adult oncology program and take care of kids with all sorts of cancer diagnoses. Childhood cancer it can be so many things, and I think that's what makes it so hard to define and so hard to talk about, because the diagnoses are so diverse. And with a diverse diagnosis, it means that there's a ton of different treatment options, and those treatment options can range from having surgery, so needing to take out a tumor by having surgery, and sometimes multiple surgeries, by having chemotherapy, and chemotherapy is medications that can treat the cancer, both sometimes solid tumors and what we call liquid tumors, which are like leukemias or lymphomas. And what's so hard about chemotherapies is there's a ton of different ones, and they all have side effects that really suck. So we end up using medicines that sometimes make you feel worse than you already feel to treat the cancer. Another way we sometimes treat cancer is by using radiation, which is something that we use. Our wonderful radiation oncologists will meet with families and talk about how they can try to target these tumors based by putting you kind of into a machine and treating it with external little atoms, which is kind of so crazy to think about. Now we're using immunotherapy, which is having your own body's immune system, or sometimes outside immune systems, are redirected and taught to attack the cancers inside of you. And we even have what we call targeted therapies now, which means that we have certain maybe pills or IV medications that are specific towards the cancer itself. Because the other thing that stinks about chemotherapy, and what I like to tell a lot of my patients, is that it's really great at killing cancer. It's also really stupid. It kills all sorts of other normal cells in your body. So all those cells that are normally growing and dividing, like your hair cells, and sometimes you don't heal as well, and your bone marrow, and so you don't make blood like you're supposed to. So it can cause all of these side effects, because it doesn't just treat cancer, it affects all the organs in your body. Camp for me is a healing environment. As a provider, I get to go to a place where I get to see kids be kids and families be families and communities come together and support each other. And I truly believe that the most important part of being a human in this world is community, and finding out that people are so much more similar than they are different. And I think camp is one of those magical experiences that brings people together that otherwise wouldn't be brought together. And they're brought together by something really crappy, by one of their children having a cancer diagnosis. But they're forced into this kind of community together, but camp brings out the best in all of that. The bonds that we see between the kids, between the parents, between the counselors, the medical staff, it's a truly magical environment, and it's a place where you're allowed to be vulnerable without concern that it will be taken in the wrong way. So it's one of the safest places that I've ever experienced, and it's something that I very much appreciate about the whole community.